Lung cancer remains the leading cause of cancer death in the U.S., yet it's still often misunderstood and frequently caught too late. Medical oncologist Dr. Julie Bramer and lung cancer patient Colette Smith join me now to bring awareness and explain how PD-L1 testing is helping guide treatment decisions. Thank you both so much for joining us today. Dr. Bramer, let's start with you, though. How do you explain PD-L1 to your patients?
So PD-L1 is a protein on a cell surface, and cancer cells actually use it to make it invisible to the immune system, kind of like an invisibility cloak.
Oh, that's so interesting. So how has PD-L1 testing changed lung cancer treatment in recent years?
So we look at PD-L1 testing on a cancer biopsy, and the amount helps guide us to decide what type of treatment we should give to a patient. So if the PD-L1 is high on the biopsy, then we actually consider giving immunotherapy by itself without chemotherapy. If the PD-L1 level is low or not seen, then we have to give chemotherapy with immunotherapy in order to get the cancer under control.
Colette, tell us about your lung cancer diagnosis and the importance of knowing your biomarker.
Yes, I'm an 11-year lung cancer survivor, and I'm proof that screening and early detection saves lives. However, beyond that, through my biomarker testing, my care team was able to figure out what type of tumor my lung cancer was and what was the best treatment option. And based on that, I had my upper left lung removed, and today I have no evidence of disease.
Wow. Well, I'm so glad that you're doing well. That's amazing. If you don't mind me asking, could you tell us a little bit about your symptoms?
I had no symptoms.
Really?
Dr. Bramer can speak more to that.
Wow.
Yes, so some patients don't have symptoms, and actually their lung cancer is caught through other reasons why someone's going to get a scan. But obviously, for those patients who do have symptoms, you want to ask, would a scan be right for me? And then some patients who have a history of smoking are eligible to actually receive lung cancer screening, where you routinely undergo a CT scan to try to detect lung cancer early.
Right, and did I read, Colette, that you are a non-smoker?
I'm a non-smoker, however, no one deserves cancer, and what it's important for our listeners and our viewers to know is that anyone with lungs can get lung cancer.
And doctor, what should patients realistically expect from immunotherapy based on their PD-L1 level that you were talking about moments ago?
So immunotherapy treatment and the expectations depends on a lot of things. One, stage of cancer. Immunotherapy is even used in early stage cancer, even before surgery, in order to keep the cancer under control, treat the cancer, and then patients go to surgery. For patients with metastatic disease or disease that's spread outside of the chest, immunotherapy can help get the cancer under control, and in some patients, it can even cure you of your cancer. But that depends on the level of PD-L1 in the biopsy. Again, if it's high, some patients don't even need chemotherapy, and immunotherapy can get your own immune system to treat your cancer. If the PD-L1 is low or zero, then we need to combine it with chemotherapy to directly affect the cancer itself, and then immunotherapy is used to get your immune system to help keep the cancer under control. And in some cases, patients are alive and well at 5 years when we can say that they are cured of their lung cancer.
Well, I think this is fascinating, and I'm so glad that, again, Colette, that you're doing well. Doctor, if we want a little bit more information on all of this, where can we go?
We should go to lcfamerica.org for more information about biomarkers and lung cancer treatment.
Wonderful. Thank you both so much for joining us. And everyone at home, if you would like to see this interview again, just head to First Coast News Plus.